Okay, great. All right. What is going on, everybody? Malik Brown here for Rolling Out Health IQ, where we talk to trusted professionals every week about health-related issues going on in our community. And today, I'm with no other than Dr. Eric D. Griggs. He is the Assistant Vice President for Community Health Affairs, National Director of Community Medicine for the 100 Black Men of America, and also the Health Educator for Fox 8 WVUE New Orleans. Dr. Griggs, how are you doing today?
I'm good. You said a lot. Wow.
I did, right?
Like, who's that dude?
Definitely, but thank you before we start. Thank you, Dr. Griggs, for coming on and speaking with us today about everything related to vaccines, immunization, and things of that nature. We appreciate you.
Well, thank you. Thank you for having me. It's been quite a ride. Even going to med school, residency, doing medical education, never did I ever think a world would be created where people were so concentrated and knowledgeable and pseudo-knowledgeable on vaccines. I'll just say that. I mean, it was just something that as a kid, it was something that you knew you had to do, and there was no debate, there was no arguing, there was even no discussion. All right, give me a shot. Keep it moving.
Definitely. So it's funny because when I was a kid, we had to get, of course, you got to get all these shots from the vaccines and everything like that. And really didn't boggle me then. But now it's like, we take it more serious now as you get older. And now I learned that there's a World Immunization Week, which starts next week. So to you, Dr. Griggs, tell us about World Immunization Week and everything surrounding it.
So it started 12 years ago, and a few countries got together and decided that they wanted to highlight the importance of vaccines. Again, we don't appreciate the ubiquitous nature of immunizations because they were just assumed when we were kids. You just did what your parents told you. I got to get my shots to go to school. If you want to play sports in any high school, college, or the military, you just get your shots. What they put in your arm, I don't know. The reason that we're able to have that attitude is because they work and they're protective. Vaccines started years ago in the United States. The word, believe it or not, they attribute the invention of vaccines to Edward Jenner. However, what's interesting, about 100 years prior, there was a familiar name. Cotton Mather had a slave named Onesimus. Onesimus was asked by Cotton Mather, how do you deal with smallpox in your country? This was during slavery, of course, in the 1700s. And he said, well, it's something that's been happening. Onesimus informed him that this has been going on for a while in Africa and in Asia. And what they would do is they'd find someone that had the cowpox. Vacca in Latin means cow, and the word vaccine, vacca, vaccine. But they would take a little bit of the sore and then they would prick under the skin of people that weren't infected to protect them. An inoculation process. Well, they started doing that to combat smallpox here in the States. Edward Jenner picked it up 100 years later and followed it, and thus we have vaccinations, exposing your body, activating your immune system so you're protected. It's the equivalent of preparing, I don't know if you're a football fan, and I know y'all are up in Detroit. I'm a Saints fan through and through, so we won't even start.
I'm in Atlanta, so look, I'm just saying.
Well, this interview is done. I've been inoculated against Falcons. I'm allergic. So thank you. It's been a great interview. See y'all next week or not. Don't get me started, man. There's all kind of, does this ring a bell to y'all? Nah, it doesn't. Y'all can't hear. Y'all don't even know what rings are. Have y'all been inoculated against Super Bowl rings? Anyway, I digress. The purpose of immunizations is to activate your immune system like a football game. It prepares you. It's like having the other team's plays, like the scout team runs the other team's plays all week, so you're prepared. That's exactly what immunizations do. And it's the reason that it's a world thing, because people don't realize these immunizations, the reason that's important in the military, it allows us to travel. in simple terms, the bugs from one area or one country, we're not protected against because we're not exposed to. So vaccinations allow you to activate your immune system to protect you so you're able to travel. Diseases have been eliminated over the years through vaccines. The reason we don't see polio, the reason we don't, diphtheria, whooping cough, measles, mumps, rubella. I don't know anybody that had any of those things, even though we had a break during COVID. There was a polio outbreak, but vaccines actually work. So they took the concept of vaccines in each country and decided to celebrate to show the importance of vaccines. I said all I want. You got me shook up talking about, man, I'm starting to itch talking about Falcons. That's my problem.
Look,
sorry. I
should have mentioned that before we even started.
This would have been done like 3 minutes ago. All right. Who that? Yeah.
but thank you for giving us the education on definitely vaccines, immunization, everything like that. I want to ask you, because of course vaccines have been kind of the big thing, especially over the past year or so. Of course, definitely with COVID and everything, getting the COVID vaccine and things like that. But there are also other, vaccines, immunizations, like we talked about. You get them at an early age, you get them when you're military, things like that. You just they're required. What do you think is the biggest misconception about immunizations, vaccines?
So first of all, there was a huge myth that we've been fighting for years, and it was proven. There's a doctor that claimed to do a study that proved that there was a link to autism, and I'm not going to mention his name, but it was proven to be false. His license was taken. There are a lot of bad things that happened to him as a consequence of spreading that myth and the rumor because there was no causal link. It's funny. I guess it was because everyone was at home, but everyone turned into a scientist. All of a sudden, people that hated science, dudes that would ask to cheat off my paper in junior high school, coming to me, talking about they had a cousin or somebody put on a white coat and talk about they want to tell me about vaccine. I've just wasted the last 30, 40 years of my life understanding this stuff. But no, it's the mistrust and distrust of the Black and brown communities of the medical system is a pushback. The fact that the elephant in the room, I'm going to go ahead and say it, it's the COVID vaccine. There was pushback in the past. You don't hear about it as much with other diseases because it was never visible. We've never been in an age of this much transparency. There's a process of discovery, a scientific process where things have to be peer reviewed and really scrutinized before they are released to the general public. Now it's straight from the lab to Twitter, and whether it's true or not, it's true in the general public, which is a problem. So the pushback is that people want more information, which is a good thing, but they don't always have the right sources. So during COVID, what we've had to do is we've had to educate folks on the process of immunization, the purpose, and to remind people that the reason that they don't hear about certain diseases anymore, like smallpox, is because we've eliminated because of vaccines. So it's the other side of it, and I don't mean to be one big long sentence, but the other side of it, and that was important during the COVID conversation, is that people took sides. Science has been over politicized. And when you infuse the emotion into it, people don't want to listen. And it happens on both sides of the coin. So civil discourse is what's most important because you can't argue with someone and teach them at the same time because they're not going to listen once they're upset. So the goal is to educate people, realize that it's science, and teach them along the way.
For you, Dr. Griggs,
like we can teach the Falcons how to play football anytime y'all ask.
Not another one.
Anytime. I looked at my wrist. I got time today. We can help.
Look, we gonna come back to that after the interview. We gonna settle this. We gonna settle this. But in your role, Dr. Griggs, I want to ask, why was this important for you? Why was World Immunization Week important for you? Why do you want to, hone on this week and bring it out to the forefront to the community?
Well, what's most important is the fact that immunizations do save lives. And we know that there are different stages. There are some that you have to get as an infant, some you get as a child, some you get as an adult, some you get as an older adult. And we know that they work. Not isolating one, like everyone vilified the COVID vaccine and then tried to extrapolate it out to all of them. So celebrating all of them, showing the successes of the process. And that was another issue, is the fact that, and we don't give credit where credit is due, it was an African-American doctor, young lady, Dr. Kizzmekia Corbett, that came up with using a technology that already existed. There was a lot of confusion during COVID, a lot of misspeaking and miscommunication. Though it took, and I was a little nervous myself, because messenger RNA technology is new. And anytime there's something new, there's going to be skepticism, there's going to be anxiety. But when the science proves that it works, she dovetailed technology and research that had already been taking place for other conditions and experimented and figured out how to use it in the COVID vaccine process. And as a consequence of that process, now we're able to extrapolate it out to other vaccines. Basically taking the DNA sequence or the RNA sequence of the virus and dialing up what was ever present at the time, and then creating a vaccine in a few months, as opposed to the years that it takes. So it's the evolution of science that people aren't used to. It was misnamed. The whole thing, it was called Operation Warp Speed, which is it was called Operation Warp Speed if you, there's a little known fact. It was because that the director, the scientist that came up with it, was a Star Trek fan. So we called it Warp Speed. So it was poorly named, created the apprehension. So again, it's a good thing. Dr. Kizzmekia Corbett out of North Carolina, I think she's at Harvard now, came up with this groundbreaking and revolutionary process for protection moving forward. Now you're going to see vaccines being able to be produced quicker and more efficiently because of the process. So that's the whole point of this World Immunization Week, to celebrate the advances in vaccines and to encourage people to protect themselves.
And I want to hold on that, the future of vaccinations, the future of immunizations. What do you think that looks like in the next 5 years? I know you talked about it a little bit, but where do you really see this going? Do you see trusted professionals, doctors, scientists coming out with vaccines just in one day? Of course, the vaccine for COVID, I guess, took a while, but as time progresses and things change, science gets better. Where do you see the future of vaccines and immunization?
So it's interesting. That's an excellent question. I'm not going to go as far as say I see in the next 5 years, we'll have one in one day. Again, there's a scientific process of research. There are clinical trials, and then there are vaccine clinical trials, especially when kids are concerned. What was novel about the situation with COVID? And I use the word novel because novel isn't necessarily just something you read, like the Falcons should be reading a playbook to learn how to play. The novel is something that's new and it's never been done before. Like the Falcons have never won a Super Bowl. It's a novel concept. The COVID vaccine virus was novel to the human species. So it took a novel solution we found a novel solution for a novel virus, which means that we expedited because we were forced to. Never in the history of our lifetime have we ever had everyone looking for a solution all at one time. We had 8 billion people looking for a solution, and we had all of the world's resources towards that solution. So we had all the money, we had all the people, all the power, all the brightest minds in the world looking for a solution, and we found it. So it seemed like it was in record time. It can take up to 20 years. And for some diseases, we never find a vaccine for. So that was what unique, and we need to celebrate that. I think we don't emphasize the positive enough. So with respect to the future, I think this has opened a door or a window for possibilities. Okay, let's move back to, it's weird because we were all born, you and I were born in the last century, right? At the start of the century, they had horses. Here we are at the end of the century with rockets, planes, trains, cars. Now we have electric cars. So the push, because of the need to the next level of technology, is the possibilities are endless. But I don't want to put a finite period of time on it, because science is still a scientific process. We've just opened up new window to explore, and that's the amazing. See, you see me nerding out, like that's the amazing. My eyes just went straight Harry Potter. Like, wow, that's the amazing part in of science, right? Like once we realize, well, I wonder if it can do this. Well, what if we do this and this? And again, for a concentrated period of time, we had everyone in the world looking for something to save. It was like fighting aliens, really. We were trying to save humanity, and we did it. And it was vaccines that helped us open the door for us to free up and go back to some semblance of a normal life and feel like we're protected.
For sure. And you know, like we talked about for next week, I know, like we talked about earlier, I named so many titles you had, but of course, one of them was for the 100 Black men for their vaccination program tomorrow. Tell us about that. What should we be expecting as far as everything surrounding that?
Well, it's just more of the same. It's like a precursor to next week, trying to encourage people to come out and really get vaccinated. Look at your vaccination records. When was the last time, let me ask you, when was the last time you looked at your vaccination record?
You posed a good question.
Oh yeah, so it's about the same as when the last time y'all won a Super Bowl. Same pause. It's called that is called the cortisol response. The body under stressful conditions operates on two hormones: cortisol to make sure you have enough sugar and simplifies your decision processes. It's the one that makes you pause, like a deer in headlights, like you just did when I asked about football and about your vaccination record, and epinephrine, of course, to make sure your blood pressure's up in case you need to fight or fly. So I wouldn't recommend. We're too. Apparently falcons don't fly. I digress. Tomorrow, we'll be emphasizing the importance of immunizations. You want people to look at the vaccination records. We still are pushing people, emphasizing the importance of getting vaccinated for COVID. It's not Voldemort. It's not that which must not be named. Let's call a thing. It's still here. We have anywhere from 300 to 400 people dying a day from it now, which is unprecedented. That's wartime. By the end of the year, that's anywhere from 100,000 to 150,000 people, and that's not normal. The flu kills 50 to 70,000 on a high year. We're talking about something that we're all acting like it's just, it's no big deal. That's going to kill 150 to 120 to 150,000 people. Now, vaccinations, the importance of getting vaccinated a lot of times isn't such that it will prevent you from catching a disease, but it will make it so that you're not sick and that you don't die. And that's hugely important. And we know there's a thing called long COVID. So all of this type of awareness, the opportunity for boosters, the opportunities for vaccines, all of this is at the forefront of tomorrow. It's a precursor for what's going to be emphasized next week.
And just going to make it more broader, of course, just the Black community in general. Of course, it's just for the 100 Black men, but for the Black community, when we talk about vaccines, immunization, of course, there's so many things that we can talk about as far as health discrepancies and health-related issues when it comes to Black people specifically. But why is this specifically important for the Black community?
Well, because at the beginning of the pandemic, it was the governor here in Louisiana. We were number 3. I think New Orleans was number 3 in the world, and it was a joke at the very beginning. We cracking and facking and laughing the whole time, thinking, Black people don't get COVID. Look, it's not in Africa. Man, I don't know nobody with COVID and da-da-da. Then our governor, Governor Edwards, went on television on a world stage and said that 7 out of 10 bodies showing up in the morgue look like you and I. And it got serious. We didn't even have vaccines then. All we knew to do to flatten the curve was to mask up and stay home. And then the vaccines came out, and we came out in droves to get vaccinated. And we were able in New Orleans to flatten the curve prior to vaccines. And once they came out, we stepped it up, and we've been vaccinated. The issue in the Black community is distrust. We have a long, storied, and well-substantiated history of distrust with the healthcare system here in our country, from Middle Passage even to now. But the best way to handle it is to address it and to talk about the way these vaccines came about. They're safe. There's an internal institutional review boards, things to make sure they're healthy, and they're safe and healthy for volunteers in the process. So it's important because we are most vulnerable. We are the most vulnerable for a lot of conditions that we know about. And, this one showed the numbers were highest in our communities here in the States. And that was part of the problem, until you get people to trust you by listening to them and having a civil discourse, dealing with the emotion, getting past the emotion, the initial emotion, and educating and empowering and having real, true discussions, you can't make progress. So it's got to be a consistent thing that we're doing, having these conversations. And, I literally, in front of millions of people, I go on TV and say, listen, if you got smoke, bring me the smoke. I like to smoke. I don't smoke, but I like smoke. Bring it all. You bring your sources and your data and your doctors, and I'll bring mine, and let's talk about it. And then my job isn't to convince you or force you to get vaccinated. It's to educate you so you can make the best decision for you to protect yourself. I know that vaccines work, and you might take a little convincing. And I tell people, you either see me now to find out where to get vaccinated, or see me later to find out where you go to the doctor because you're sick. So I'll be here anyway, and I'm not going to judge.
What do you say to that person that maybe still unsure, maybe still anxious? I know you talked about earlier, at the beginning, you're anxious, you're nervous, because this is something new. But for that person that's still having questions, still trying to figure out, is this safe? Should I trust this? What do you say to that person to give them to hope, positive energy? What do you say to that person?
Well, what I do is I tell them to call me, and I give them my email address. I give them access. I say, when you want to sit down, give me all of your questions and let's talk about them. And I don't plan on trying to change your mind in one conversation. For some people, it does happen. For others, I don't mind talking with you about it until you get tired of talking. I just want you to protect yourself. And then once we get past that, I say, so what are you going to do to protect yourself? Well, I'm just going to stay inside. I work from home. I don't go around people. When I go outside, I wear a mask. I wash my hands. Some people still wear gloves. But if that's the way you feel that you're best protected, then that's fine. And I also tell them, once you contract it, because I've had to deal with this in my family, in my friend circle, I don't believe in it. It's not true. And doc, you don't know what you're talking about. It's a conspiracy. And then the moment they catch, doc, what do I need to do? Can I get the vaccine now? No. We're going to weather the storm and we'll monitor you. I'm here to help, and I'm here to educate and support you. So that it's not an antagonistic role that I take. It's an educating and supportive and empowering role that I try to take. I mean, it's everyone has to learn on their own path, and this body is your body. And all I can do is try to educate you. Now, there will be restrictions and certain barriers and things you might not be able to do, but if you make a certain decision, you have to deal with those consequences.
Well, Dr. Griggs, before we go, I want to ask you, of course, with World Immunization Week coming up.
I mean, you decided to be a Falcon fan, you still cheer for him.
Rise up.
Anyway.
Rise up.
Rise up to where? Where? Where else you want to go? Y'all done made it to the Super Bowl. Do I need to? Don't get me started with 28-3. I can give you 28 reasons.
No.
Reasons.
We can't do that. We can't do that.
Not to talk about it. And three reasons I want to talk about
it. Dr. Griggs, where can we find places to get vaccinated, immunized next week? Besides our local doctors, are there any special places that we should be looking at next week, since it is World Immunization Week?
So if you can Google the NCRN Network, National COVID Resiliency Network, there's a plethora of resources on that page. The CDC has pages. If you want to find resources, you can also just Google COVID resource, COVID vaccinations, COVID information in your particular zip code. But the NCRN Network has an excellent website that has everything that you would need. If anyone has any questions, they can reach out directly to .griggs1@gmail, and I like the smoke. I'll answer any questions patiently and try to be supportive as I can.
Well, thank you so much, Dr. Griggs, for coming on, speak with us about World Immunization Week, about the 100 Black Men program, vaccination program tomorrow. We appreciate you for coming on, giving us some laughs for sure, giving me some laughs. Rise up and thank you again.
Man, I'm just trying to keep you laughing, to keep from crying, man. I know it's been a long road. It's been tough. It's been a tough. Just keep wading in the water, wading in the water, wading in the water. Yeah, keep going, keep wading.
Thank you so much, Dr. Griggs. Thank you, everybody, for checking us out. This is Health IQ, your host, Malik Brown, my special guest, Dr. Eric D. Griggs, and we